I decided to go into medicine because I really loved the challenge of the science behind helping people out. But really, the main reason I went into medicine was I just enjoyed helping people. Even from a very young age, I always thought that it was good to see people kind of getting better after they visited their doctors and such. And I really fell in love with the challenge of medicine and then kind of helping people out with their problems. I have specialized training in hip and knee replacements, including anterior approach hip surgery, and then partial knee replacements, including total knee replacements, and rapid recovery joint replacement. That's the main thing that I focus on. So that's one of the reasons I decided to come here, is because we have a great team dynamic, and I really think that helping patients, it takes more than just me, it's a whole team. Everyone from the office staff to the nurses in the hospital to the people in the OR, and then me as a surgeon. So I think that we have a great team dynamic here. Everyone is very helpful. We're all on the same page, and we all have a common goal of treating our patients and making them better. And I think that that's having practiced in many places in my career, I think that that's a unique thing that we have here at Northeast Georgia.